Right, Tanner, are we live yet?
One more refresh.
All right, we are live. Good afternoon. This is American Surgery Center Bariatric Program. I'm here with Dr. Isaias Irgau from CHRIAS. My name is Kemal Erkan. I'm the chairman of American Surgery Center as well as United Medical ACO. We have another topics to discuss today, so we are going to start with Dr. Irgau. And Dr. Irgau, if you can please introduce yourself.
Yes, thank you, Kemal. My name is Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery, which I have been practicing for almost 20 years, along with my colleagues at CHRIAS. We are actually the most experienced group when it comes to bariatric surgery in our area. I'm always very happy to be here for another discussion topic, Kemal.
Thank you, Dr. Irgau. And I do want to make sure that I introduce our other surgeons as well. We have Dr. Gail Wynn. She's been with the practice for almost 20 years. Dr. Mike Peters, Dr. Rahul Singh, Dr. George Ibrahim. 5 surgeons are on the bariatric side. And also we have Dr. Sachin Vaid, who's our colorectal surgeon. And we have Sydney Ondrasik, so that's her new last name, so I have to study that. So she is our surgical assistant, and they are one of the best teams in United States. Our nutritionists, dietitians, Fran, Amy, and Beth, they work with our patients directly. And the as most of you already know, what we have on the process of the bariatric surgery journey is something that we already discussed several times, which we are going to actually do more of those discussions this coming year in 2021. And so those are getting your referral from your PCP, getting your consults for the surgery between the second step and the surgical clearance. There are several different things that we have. We are helping our patients. And then your surgery schedule. So your path to resolution is kind of a long process, but we are here to help. Well, we are kind of starting a couple days earlier, Dr. Irgau. So the New Year resolution. So personally, I don't believe in New Year resolutions. So I really don't. But I know that right now, one of the most important things for people, 1 year is ending, and hopefully 2021 will be a much better year. But I think there's this expectation from the new year, and many of us are making plans, and some of us do act on these plans, and some of them are not. So for our patients with obesity, this is a little bit different and more challenging. So, and I know this is your expertise, but if you can kind of give us the patient perspective of the New Year resolution for our patients.
Absolutely, Kemal. So I get it, Kemal. There is disillusion with New Year resolutions because very often those resolutions don't last the first week, or maybe perhaps at the very best, the first month of the new year, okay? And then we found ourselves looking for another resolution on the following year. This coming new year is particularly relevant for all of us, as you mentioned, because we've had such a difficult 2020 as a community, as humanity globally, just because of the impact the coronavirus has had on all of us in terms of really taking away the normality of our daily life. So we are all very much eager to start a new chapter where we're hoping it will be a much better year. Going back to the issue of resolution, the new year marks the beginning of a different year. So it is natural for people to feel that they can start over again. They can do something that they felt they didn't do as well in the previous year. And it's a landmark. They look forward to a new beginning. Not surprisingly, Kemal, one of the most common, if not the commonest New Year resolution is losing weight. And guess what? It happens year after year because we lose that struggle. We lose that fight every year, right? And we find ourselves having to make the same resolution again, right? So really looking at losing weight in the new year is something that we always talk about because it's so difficult and because there is so much struggle. Yeah, yes, now we are 2 days before the onset of the new year, and it's really appropriate for us to talk on how we can focus ourselves to try to really make some headway in our struggle against weight. Of course, because we are so much dedicated and interested in weight loss in our specialty, this is particularly important for our patients. Not only for the patients who are struggling and have never come to our practice, either because they don't know much about weight loss surgery or frankly because they don't qualify for weight loss surgery, just because the amount of weight they need to lose may not be as much as our normal patients. Really looking forward to helping them is really part of what we do. So it's really appropriate for you and I to talk about what can we do in the new year for us to be successful in losing weight, not necessarily as only bariatric patients, but also generally. And I would like us to expand on that, to share our experiences and perhaps us to our knowledge on what practically people should do to try to lose weight in the new year.
So Dr. Irgau, what I would like to do is, well, wasn't planning on it, but just bear with me here. So when we do our daily case conferences, so this is, sometimes maybe people are not in medical settings, they may not really understand the discipline of doing something every day.
Yes.
This is so important. So
yeah.
Now, why I say this is because if we don't do those daily case conferences, it's not just one person. There are like 6, 7, 8 of us and different levels, different positions. So we actually see how patients are struggling day to day. Now, I have 2 of our patients that I had from this week, and one of them is struggling to get the 3rd time actually trying to get to the program. And last year, she was at 369 pounds. Mm-hmm. And today, self-reported, because it was a telemedicine, she's 400, but she's actually about 425 pounds. Mm-hmm. So in 1 year's delay, our 369 pound patient is already at 425. 425. So this is not a lifestyle or the choices, or this is a chronic illness. So when we talk about the resolution or New Year resolution for patients with obesity, this is a different game. So, but one of the things that I want to point out here is delaying everything for 1 year, it costs this patient for another 65 pounds. So, now, what can this patient do for New Year resolution? Maybe like we can kind of just take a different detour on this. Like, what can I, like if I call this patient, what should I tell her that she should be doing?
So Kemal, this is a very, very important case scenario, right? And it's real life, and it's probably duplicated in many settings throughout our community as well, where obesity really is rampant in our society, right? When you get to levels of weight that you have mentioned, right? When you're in the 300 plus, when you're in the 400 plus, it is almost impossible to lose weight without the help of bariatric surgery. This is just a fact right now, right? Now, is there a minuscule number of people who are able to do it without bariatric surgery? Perhaps, right? But for the vast majority of people in the real world, the only hope really is bariatric surgery. And bariatric surgery has become so safe, so well undertaken right now that as a treatment is recommended by all doctors for levels of obesity that you have mentioned, right? So for that patient to really stay at that level of weight and continue to get weight, it is really a real danger to their life, real danger. I have had patients who have had heart attacks, who've had severe illnesses because of worsening diabetes, who've had strokes because of worsening blood pressure when the levels of weight reach that level. So it is a danger to their life. So the best New Year resolution for that person would be to really continue in the program to be prepared for bariatric surgery so they can safely get the treatment that they need for them to become healthy again. I see no other resolution for that patient. And I'm hoping that in your conversation with that patient, this is the agreement that you and that patient have reached.
So it's kind of like that fine line that we try to walk, Dr. Irgau. So when we call, in some cases, they really don't know why we are calling. If they, they're already struggling. In some cases, some patients don't have like scale at home. So how is that possible, right? So when someone has a chronic illness at this level. So now another patient of ours from this week again, it's BMI 47, and she dropped out this week, and she completed 6 nutrition classes, completed half of the clearances, spent quite a bit of time between different appointments, and at some point she lost her some motivation, something that happened there. Now, if I were to call this patient for the New Year resolution, I really wanted her to just sign back in and then just schedule her surgery because she can be done in the next month or so. Because what's happening is from this, 1 year later, you add another 60 pounds. So we discussed these in a couple of our other sessions. Now, when we really talk about New Year resolution, I mean, we can have like, so many different ways to put this out there, just make it like so shiny, but it's not. It's like the reality hits, the reality actually is different. So we want to make sure that we can help our patients in a timely manner when it's easier. So every time we have to go through the resolution process, we know that things are being more difficult. Now, I know, Dr. Irgau, with this one, the same topic that we have, something
can
that...
Can I just get back to that point for a second, Kemal, because I think it's very important. So, in our experience, as we've seen, when we encounter patients for the first time, when they come for consultation, it turns out that the vast majority of patients actually have thought about bariatric surgery way longer than that first phone call they made to come for our consultation. In fact, on average, most bariatric patients have thought about bariatric surgery for 2 years before actually coming in for the actual consultation and looking at it. The normal situation is actually the first time a person thinks or hears about bariatric surgery, they reject the idea as something that it's not for them. They completely reject it, right? Because it is surgery, there are fundamental changes, and also they feel somehow defeated. Just because of the stigma of obesity, they feel as if they have defeated themselves by not doing it by themselves, as if there is some magic way of doing it by yourself, as if it's only their fault. And it's part of the perception of obesity that has been prevalent in our society, to think of obesity not as a disease, but as something that a person is responsible for. And in other words, if you're responsible for it, you're responsible for getting out of it as well. And yet it's not so simple. We very well know that for people who struggle with obesity, it's far easier for them to gain weight than it is to lose weight. That's why they have this resolution year after year. So when it comes to bariatric surgery, their first reaction is to reject it. And then over time, the idea matures and they understand and they participate in educational encounters like this one to understand really it's not about them or their fault. It's about a biology that is really driving this weight up year and year after year. And they understand that bariatric surgery is a treatment. Now, when you think about surgery, the first thing you think is surgery. I'm going to go under the knife. I'm going to go under anesthesia. So all that creates anxiety, right? Like any surgery. But once you understand that the risks of that obesity are far, far, far worse than the risks of surgery, particularly surgery, the way it's undertaken in centers like that, then you change your mind. It is not unusual also for people who go through the process and then change their mind because they're frightened. And our job is to just educate them. Nothing but education. Come on.
You know, Dr. Irgau, I'll tell you something. You know, people probably, hopefully they understand this, but we don't rehearse these meetings. So we discuss the topic, although today's topic was understood differently, right? So we don't, this is like as casual and as, well, it's as casual as possible. So, so I'm going to bring up something. So, and I may be totally offline with this, but I don't think I am. I think the issue, what I'm hearing from you is, and what's also probably hurting people is when the perception of the bariatric surgery. So now many of our followers, our patients do know that I'm from Turkey, and I still do watch some of Turkish shows. And one of the TV hosts that I'm going to share with you guys right now, because it's public, so I think I should be okay. So her name is Seraya, Dr. Irgau. So she had a surgery. She had a bariatric surgery, bypass, and she has her own TV show. She's a singer. She was at around like 80 kilos, and she's now down to 46. Now she had a revision. They call it revision, but it's like really mini bypass.
Okay. Okay.
So, but then okay, so I'm going to confess here, I was watching it. So in case my family is watching it, so they already know that I do kind of have junk news addiction too. So she, the way that she was talking, they were on the phone with their doctors. She is clueless as a patient.
Okay.
So now why I say that is because the issue, I actually sent her a message. So you don't know this yet, but you're going to maybe talk to her.
Okay.
if she decides to, connect. The reason we do that, because I understand how limited her knowledge, and she's, she's higher up in everything that she does. So you would think that she would know. So there's this perception. Every time we say surgery, like I told you, like every time I say bariatric, my mom goes, "Oh my God, like don't get a surgery." I'm like, we are not talking about patients who are 25, 26, 27 BMIs. We are talking about patients 400 pounds, 360 pounds, 425 pounds. So then there's this bad publicity. So I actually wanted to reach out to that channel and then say, well, you shouldn't be publishing this because you are giving the wrong information. If the program is not run professionally, and if you don't have the procedures, and if you don't have the standards, yes, you are going to go through that trouble that lady is going right now. But now this one bad example, it's almost like how it is with the COVID vaccine. So there are 3 allergies, reactions, and then boom, you're going to cancel the entire population's future. So that's just like, that's where the, kind of the problem I think we have. So I really want to kind of tie that into our resolution issues. Well, sign up with the program. And now one thing that I was thinking, Dr. Irgau, for the time being, while they are with us, before, after, there's also this misperception of the intermittent diet, which you introduced me to. Right? So one day, so I was in the CHRIAS conference room, and Dr. Irgau, he's one of my best friends, and he's one of the nicest people. Boom, he just told my face that I have to lose 35 pounds. Do you remember that, Dr.?
Less than that.
35 pounds. And I'm like, oh my God, like I must look really horrible. And if for you to really say that. So, and maybe next time I'll bring pictures, Dr. Irgau, for this session, because that was with our town hall meeting.
Right.
And then you didn't like the way that I look that time, not because of the look, but just the health-wise. And
Yes.
I can see in some pictures from that event, this was
Yep.
2000, late part of 2018, and we started the intermittent diet together. And until the COVID-19 started, the pandemic started, I was on it.
Yep.
And I was at my best shape.
Yep. Yep.
And then, so we went home, everyone started working from home. And for whatever reason, we understood that as like, just eat as much as you can and then just cook everything that you didn't do in the last 20 years.
Yep.
And I did
Yep.
that. So, and now it's almost 3 weeks, we went back.
Yep. Yep.
And I see the benefit of it personally.
Yep.
From the, from the personal side, I do. But Dr. Irgau, you explained this so well, and you and I, we discussed this several times. We watched so many videos related to this from different sources. What can the patients do, especially patients of bariatric, for the how can this help us?
Absolutely, yeah, absolutely, yeah. So one of the issues that we need to deal with is struggling with gaining weight despite different things we do to curb how much we eat and to increase our activity level. And obviously, very often we're defeated with that. Now, I like the idea of intermittent fasting, not necessarily just for my bariatric patients who are struggling with weight gain or bariatric patients who are not losing as much, different methods, but to me, intermittent fasting makes intuitive sense, okay? Because what it does essentially is it tells us that we consume food in our waking hours, right? When we are asleep, we don't consume any food, right? When we are asleep, in fact, the only thing that goes in and out of our body is oxygen, air, right? We breathe in and out. That's all we do. We don't consume any calories, right? So if we can limit the times in which we consume food, right, in a scheduled manner in our waking hours, we will be stretching the hours of the day in which we're not eating. In other words, although we are awake, we will be acting as if we are asleep, right? Because we're fasting when we're asleep, and if we don't eat when we are awake, we're acting in the same manner. In other words, we will be expanding the fasting hours of our 24-hour day. That is the basis of intermittent fasting. So essentially what we're saying to ourselves is that one of the reasons we're struggling is because there is this mindless eating that we continually do, right? Not necessarily just when we sit for meals, but because it is a wide open situation. There is no question that if I see a candy on a table, it's okay to eat it. If there is some food laid out in our working place and my coworker tells me, hey, have something, I am going to have something. The issue here is that every time some calories enter our system, the whole process of digesting that food and changing it into calorie and nutrients starts churning, starts working in our body, okay? And that process continues on and on and on again. And it turns out that every time that engine is on, not only we're adding calories to our bodies, but we're actually aging more as well. So it turns out that if we limit really the hours in which we eat, not only we're able to control the amount of calorie that get in, but also we become healthier by default because we're not turning that engine continuously. So intermittent fasting can help you lose weight. It reduces insulin resistance. Every time we eat, what we're doing is we're getting the insulin to spike up. Well, insulin goes up in our blood to regulate blood sugar, but the other thing that insulin does is it shuts down the cells that contain fat and it tells them, hold on to the fat, don't give out the fat for it to be used for calories. So every time we eat, we're encouraging this process of conserving energy, right? So if we're not eating, if we're just drinking water for long periods of time during our waking day, the insulin level stays flat and our cells are free to utilize the fat that will be consumed for calorie purposes. So intermittent fasting actually makes sense, but also from a scientific point of view, it does have a good basis. It has become much more popular in the last few years. It's being adopted by more and more people, and it seems to fit well within the busy schedules that we have in our societies right now, right? Because we're busy through the day. If instead of grabbing to a snack, we drink water, and then we say, okay, these hours are the hours in which I will allow myself to eat, and then we eat, and then we stop eating after that, depending on what schedule we get, I think the success rate could be higher. So if there is any one New Year's resolution that I would like to really encourage people to do is to look into intermittent fasting. And this is not just for the patient, for people, for our bariatric patients who may be struggling with losing the extra few pounds that they want to lose, or because they've gained a few pounds during the pandemic. It's really for anybody who's interested in becoming healthy.
So, Dr. I have some questions related to this, and these are the ones that you answered for me, but there were longer discussions. So since our time is kind of limited here, so I'm going to ask you some of those. I benefited from those. I'm going to ask you to maybe repeat this eating issue, because in the beginning of the diet, if you remember, I was kind of making the mistake of having some small piece.
Yes.
So when we say 16 hours no food, but water, can I have like a bag of mixed nuts or almonds, or we can't, right?
You cannot. That's the essence of it. The essence, as you correctly say, remember, you actually came up with the analogy about our digestive system, right? I told you either turn it on or you don't, or it's off, right? And you said, yeah, we don't have a microwave, we have an oven, right? We cannot cook something for a little bit. Yeah, absolutely. You said it's either on or off. It's not can be turned off a little bit or turned on a little bit, right? Our digestive system, whether we grab a couple of almonds or one cookie, or whether we eat a full meal, it's going to be turned on regardless, and the whole machinery will go on, right? So if you really want the intermittent fasting to work, you during your fasting hours, you just have to do water. Of course, you can do decaf tea, decaf coffee without any sugar, right? But you can do those things. You have to stay hydrated. You have to drink plenty of water. It's very important you do that. But you must avoid any type of calories during those times of fasting. So to just give an example, Kemal, if you say, for instance, you're going to do 8 and 16, it means that you're not going to eat anything with calorie for 16 hours. And that includes the time in which you're asleep, right? So for instance, if you go to bed at 10 o'clock and you decide to stop eating at 8 p.m., right? And then you don't have anything to eat until about 12 noon the next day, there you have from 8 p.m. until 12 noon the next day, you have been fasting, right? And if your first meal is going to be at 12, you've been fasting now for 16 hours, right? And then the time period you have available to eat will be that 8 hours. So your eating window is narrow and your fasting time is expanded, essentially. And that's how it is structured.
So, Dr. Khan, the part that kind of makes a lot of sense right now, the way that my schedule is, so I stopped eating around 10 to 11 p.m. at night. And then 7 to 8 p.m. next day is my eating period. So now I'm able to do this with no problem Monday through Friday.
Yes.
I'm not going to lie to you, over the weekends I do cheat. So but you immediately feel a lot better. And I think one, and correct me if I'm wrong, but where the intermittent diet came from originally was for aging-related studies.
Yes, absolutely.
Now, my dad, you and I, we talk about him a lot. So he actually fasts Mondays and Thursdays. For a long time, he did that. I think this year may be the first time he's not doing. He's going to be 80 this in 2021, and I can see that he also benefited from this. So many of us really don't understand the impact of the extra weight that eating brings in. So in the office, when I don't eat lunch, I don't have any of the problems that I normally would have, puffy, swollen hands and the redness and feeling tired, even the focus is
Yes,
better.
better.
So
Absolutely.
I am going to actually bring some pictures in the next sessions. So I normally, like, I'm a little bit superficial for that, but I will show you a couple bad pictures. And then from the same event, like after you told me what you did and what we had in the 6-month period, it was amazing.
Absolutely,
So,
absolutely, absolutely.
I think you see the benefit as from aging as well as the weight loss part of it is extremely good, and you do feel much better. Anything you want to add, Dr. Irgau?
Yeah, absolutely. So for my patients particularly, right, when they come and they ask me, hey, the pandemic has made me put on extra few pounds, how am I going to get rid of them? And then I'm struggling to lose this extra 10 pounds to get to my ideal body weight. I tell them about intermittent fasting, right? And I work with them based on their own schedule, okay? Now, sometimes we don't want to, as you say, kill the good for the perfect, right? Come out. So if somebody can do it Monday to Friday and they struggle on weekends, good. Do it Monday to Friday. It's better than nothing, essentially. But having that mentality of really looking at food and say, not just eat it mindlessly, but say, is it my time to eat it? That by itself is a complete change in the way we live, right? So we free ourselves from this continuous oppressive need to put something in our mouths if we have a schedule in front of us. And that's the key. And then the benefit, as you said, Kemal, is huge because when our body is not working so hard continuously to try to digest things that we could continuously in our mouth, it becomes a younger and healthier body. And we feel it, as you said, your focus is better, right? You have less inflammation, you're less tired. All those are the benefits of really having a prolonged fasting period during the day. So that's what I encourage my patients.
Definitely.
And I think it's an interesting topic. I'm really glad you brought it up, actually.
Yeah, I think we should probably spend another session
Yeah.
in 2021 because I tell everyone the benefits, including
Absolutely.
my family.
Absolutely.
But I think this needs to be better understood by people. The perception of eat like 3 times, 3 hours, every 3 hours, small meals. Now, like when you think about it from this point of not eating because you actually shouldn't be, when we tell people you have to eat every 3 hours, like it's a big contradiction. So I think we should spend maybe another session next year. Now, what I would like to remind everyone, this year was a very challenging year for all of us. From the practice standpoint, we have done almost a complete transition in terms of the in-person versus virtual meetings, appointments. We still have office hours. We still see patients in the office where we have to. But if we don't have to, we have them on telemedicine. So this means everyone, all the patients should be on their patient portal. This is extremely important for your own mental health because otherwise you'll be on hold for 20 minutes for something that you can cancel at home in less than 10 seconds. Next year, we'll start repeating this entire playlist of the bariatric surgery journey. With same topics, but maybe different providers, mainly with Dr. Irgau. And then Wednesday, 3 p.m., we'll keep that. And also our weight loss webinars on Tuesdays, that's twice a month. That's gonna be on the schedule. And the first Tuesday of each month, we have the support group meeting. That's gonna be through Zoom. As usual, you can subscribe to our channels, especially on YouTube, to get the most updates, most recent updates. And are not patients of bariatric, they are benefiting from these events, and hopefully we'll keep repeating them. And Dr. Irgau, thank you for your time again. I know.
Thank you very much.
Everything that you guys do for us.
Thank you.
Now, you did get your vaccine. You were in my vaccine video. Thank you for that. As most of everyone knows who's watching us, Dr. Irgau is one of the best bariatric surgeons in the United States, maybe in the world.
Thank you.
He got vaccinated. So don't be stupid. Please get your vaccine when it's available to you. So it's our life and our future, so we cannot really play with that. And then Happy New Year. So as we have
Happy New Year. Yeah.
and we have one more session today at 5 p.m. If you can get enough of us, enough from these, you can actually come to the 5 p.m. meeting. Will be more on the COVID related stuff, and we'll see you there. Otherwise, we'll see you next